Hi everyone, my name is Jasmine Naranjo. Today I'll be talking about the mental health disparities in the prison system, specifically among the male population. But first, some background information about me. I was born in Queens and raised in the Bronx, New York, where I currently attend Lehman College as a sophomore and am majoring in both biology and computer information systems. I have also had the pleasure to advocate for my fellow peers and students as an SGA representative. I am also interested in pursuing a career in healthcare medicine and learning more about the specialties of pediatrics, neurology, and anesthesiology. Now let's take a look into the prison system. In the year 2020, there were 2.3 million people incarcerated in the US alone, with 97% of that population being male. Specifically, in the state of New York, there are over 50 correctional facilities, with 53 in total, one of which is the Rikers Island Jail Complex, which can be seen on the right, which has a daily population of 10,000 people. Since the year 2010, suicide rates have greatly increased in the prison system, with 2020 being marked the highest year in the last decade of suicide deaths, and 29% of those deaths occurring in solitary confinement. Due to circumstances such as these, there has been an increase in mental health illnesses in the male incarcerated population. The prison population, specifically males, are one of the most vulnerable groups and most likely to develop mental health disorders. According to the American Psychiatric Association, between 2.3 to 3.9% of inmates have schizophrenia, while 13.1 to 18.6% suffer from depression, and 2.1 to 4.3% have a bipolar disorder. Many of these disorders stem from various factors that inmates face in these correctional facilities, such as violence, overcrowding, enforced solitude, isolation from social networks, and lack of healthcare services. These factors, in turn, increase the risk of suicide in prisons, which in most cases are related to depression. As seen on this graph, suicide rates in jails have nearly tripled in the last couple of years, in comparison to that of the US population. Kalief Browder's story sheds light on the mental health illnesses the prison system creates, as after being wrongly accused of stealing a backpack, Browder spent nearly 2 years in Rikers Island in solitary confinement awaiting his trial. Upon release, he was diagnosed to have severe depression and ended up committing suicide in 2015. As a future healthcare professional, in order to implement change in the prison system, I would advocate for inmates and work with organizations, such as CASES, to ensure that they receive the appropriate mental health care needed. I would motivate the need for workers such as correctional officers to receive training on discerning distinct types of mental illnesses, as well as serve as a volunteer in local prisons such as Rikers to assist the population in overcoming any mental illnesses that they may be facing. To conclude, I'd like to thank the MonteHOP program for providing me with the resources to further progress in my medical career and help those in need in the community.